An 8-year-old girl, Parveen, was admitted at a Khammam hospital with history of fever for 1 week, severe abdominal pain and vomiting for 2 days, difficulty in breathing and altered sensorium over 1 to 2 days. She was diagnosed and treated as severe dengue shock syndrome at Khammam. She was referred to Little Stars and She Women and Children's Hospital, Hyderabad on day 7 of illness, that's 29th of August. At admission, she was in hypotensive shock, impending respiratory failure with a GCS of 8 on 15, needing crystalloid fluid resuscitation, intubation, and mechanical ventilation. Her admission SOFA score was 10, PRISM 3 score was 12, suggesting a 30% risk of mortality. Parveen was noted to have severe hypotensive, hemorrhagic, and catecholamine-resistant shock, necessitating multiple blood products like FFP, SDP, PRBC, and cryoprespirate. Her VIS score was 10, indicating the severity of DIC and coagulopathy. Parveen had impending respiratory failure in the ER at admission, necessitating intubation and mechanical ventilation. Her chest X-ray revealed massive bilateral pleural effusion, needing higher ventilatory settings. Her oxygenation index was 11, suggestive of moderate ARDS, and over the next 3 days, her ventilator requirements increased to an OI of 28, prompting initiation of high-frequency oscillatory ventilation. By day 7 of admission, that's day 14 of illness, she had a massive pulmonary hemorrhage with worsening of OI to 60 with a RESP score, that's a respiratory ECMO survival prediction score of -6, meeting ECMO criteria with only an 18% chance of survival. Due to multiple family constraints, she was continued on maximal settings on the SensorMedics 3100 HFOV and other multiple intensive and critical care measures, and after much deliberation, she was commenced on a pulse dose of methylprednisolone. Then later, she was gradually weaned to conventional mechanical ventilation after she improved, that's by day 19 of illness, and extubated to non-invasive HFNC on day 21 and nasal prong oxygen on day 25 of illness. Parveen was diagnosed to have severe dengue shock with prolonged fever, hepatosplenomegaly, bicytopenia, and elevated inflammatory markers like ferritin, fibrinogen, and D-dimer, suggestive of secondary HLH. So she had hemophagocytic lympho histiocytosis on the bone marrow with the presence of hemophagocytosis, and a course of IVIG and dexamethasone were commenced as per the HLH protocol. She was discharged home on 28 September after 3 weeks of hospitalization on nasal prong oxygen and without any focal neurological deficits.
सतीश सर का शुक्रिया अदा बोलना चाह रही हूँ मैं। सतीश सर हमारे 16 दिन में मेरी बच्ची को ठीक कर दिए, इलाज अच्छे से करके ठीक कर दिए हमारे बेटी को। अभी मैं बहुत बहुत खुश हूँ, बच्ची ठीक हो गई। इस वजह से मैं बहुत बहुत शुक्रिया बोल रही हूँ, धन्यवाद बोल रही हूँ मैं सतीश सर को। इतने अच्छे हैं कि मैं भगवान के बाद भगवान दिख रहे हैं उन्हें मेरे को। जितना भी बोलूँगी कम है उनके बारे में। मेरी बच्ची को ज़िंदगी दी है, उनका बहुत बहुत शुक्रिया, बहुत बहुत धन्यवाद। और मैं ज़िंदगी भर उनको याद कर लूँगी, दुआ कर लूँगी सतीश सर को।